Roger Williams University is hosting a crisis management seminar on May 3rd at their Providence campus. Crises, whether a natural disaster, cyber attack, or financial instability, can have severe repercussions if not handled properly. This is where crisis management plays a pivotal role. Join Roger Williams MBA students and expert speakers to learn how to prepare for the unexpected. The program is totally free and open to the public. You can register online at rwu.edu/events/crisis-management-symposium.
This is the Bartholomew Town Podcast.
The legalization of recreational cannabis going into effect this week can open doors for your career. If you are already in the industry or wondering what the best path to break into the cannabis field is, well, the University of Rhode Island has a program to help you become highly competitive in numerous areas of the cannabis industry. Fully accredited by URI's College of Pharmacy, the certificate program is 100% online and can be completed in 2 semesters. The next application deadline for the summer 2023 session is April 4th, and courses start May 9th. Learn more at uri.edu/online/cannabis or give them a call at 401-874-5280.
I'm really excited to speak with you today. I'm Stephanie Forschner-Dancause. I am an assistant teaching professor at University of Rhode Island. I have a background in natural product chemistry, and I'm really excited about sort of the chemistry that nature makes. And that is how I got into, the cannabis field, and the interest in the cannabis field is because here we have this, plant that just makes so much amazing chemistry. And so much of that chemistry has, the ability to impact human health. And so those are where my interests lie sort of professionally. And I've also become the director of the cannabis certificate program at the University of Rhode Island, which we have now also evolved into having a minor at the university in cannabis studies.
And that's such a radically different place from when I was a student at the University of Rhode Island. I mean, put it this way, cannabis was definitely a part of the University of Rhode Island, but not in the way that it is today. And look, yesterday, we're recording this on December 2nd. Yesterday was the first day of recreational adult use legalization retail sales here in Rhode Island. And there was a lot of fanfare. I know at one of the dispensaries, they had a steel drum player, and it was a very newsy story for sure. It seems like it's been a long time coming. No question about it, with Massachusetts having been well ahead of us in that regard, and many other states, of course, as well. But just on that point, from your perspective, what does this mean for the average Rhode Islander? Because there's a lot of talk about increase in motor vehicle accidents, or now you're going, someone even said, oh, well, now the workforce in Rhode Island is going to be, further depleted because you're going to have a bunch of people who are, I heard someone say on dope, so there's still these sort of thoughts out there. What's your assessment of this from an academic standpoint?
Yeah, so there's a lot of stigma that surrounds cannabis from, years of the war on drugs and what we were told growing up. And really, when it comes down to it, that if you compare cannabis to our other legal recreational drugs like alcohol or tobacco, that it's relatively safe compared to those other ones. Not to say that there aren't risks. So there is definitely impaired motor control that can happen, and that's why there's this concern with increased motor vehicle accidents. But I think that if people are consume responsibly, it is relatively safe. And I know that in other states that have gone recreational, they haven't seen these big jumps that people are afraid of motor vehicle accidents, or, people being admitted to hospitals, or, a lot of that fear that was there. And instead they are seeing, on the other side, some positive effects. Some states are reporting decreases in opioid use, and so there's some positives there too.
What about for the average Rhode Islander that might be going into one of the dispensaries for the first time, and they walk in and they think maybe they haven't used cannabis in years, or maybe they've never used it, or even if they have used it, now they're faced with language, in some cases labeling, and just a product that differs greatly from perhaps their previous experience. What should they be looking for from a safety standpoint, from just a consumer best interest standpoint?
Yeah, so I think the first thing, they want to look for is cannabinoid content, which is going to be listed on all these products. And this is not our father's weed, right? Historically, THC percentages in cannabis has been around 8%. And now we're in products that are, over 20 and going over 30% in the flower itself. So, if it's been a long time, so sort of since they've had cannabis, that things have changed. That with these higher concentrations, this is where we see more of the adverse effects of cannabis, reactions that cause dysphoria or anxiety or even panic. So the big idea here from a safety standpoint is to start low, go slow is the big adage, is that, don't go straight for those high THC if you're not, familiar with the industry, and to start with some of those lower THC, and definitely, include some CBD in that. So CBD is the compound cannabidiol that doesn't have the psychoactive effect, but it does mitigate some of the effects that THC does have. So it can help, sort of stop those adverse effects like dysphoria or anxiety. So look for something that does have, a good level of CBD to counteract some of those negative effects of the THC. Also, all these products, they're very safe. Our regulations are really good. We have good testing in the state. We have reliable labs in the state, which is good that you don't see in all states. So these products are safe. They've been tested for pesticides. They've been tested for heavy metals. They've been tested for microbial contamination. Excuse me. So they are, they're reliable products. They're safe. The other thing that is probably going to be pretty eye-opening is the range of strains and the range of products. Is that, we don't just have the flower, but you're going to see things like extracts and concentrates and, lollipops and lozenges and edibles. And each of these carries their own sort of pharmacology from, a scientific standpoint, where if you think of your flower as your, beer and wine, if we want to relate it to the alcohol industry, and these concentrates more like the hard liquors, they can have much higher percentages of THC in them. So, realize those differences. Edibles, which have become extremely popular, the issue with those is that they have a really delayed onset. So people who are used to, smoking or inhaling through vaporization or something, the onset to the effects of THC in those products is very quick, about 90 seconds, and you start to feel the effects. The peak levels of those THC in circulation in the body is going to happen around, 10 minutes, and the effects will last for a few hours. Whereas with edibles, that initial onset isn't until, 90 minutes later. So what we see happening with edibles is that people will take one, they don't feel anything, so they consume more.
Yeah.
And then all of a sudden, 90 minutes, 2 hours later, you have this overconsumption. And that's where we see a lot of the adverse effects and a lot of people seeking medical attention is from this overconsumption. So really with edibles, be patient, wait an hour and a half, wait 2 hours, wait. And again, start low, go slow.
Obviously, this is not legalized, this being cannabis, besides that which was legalized or approved in the Hemp Act under the Trump administration. Cannabis is by and large not legal on a federal level, which impacts a lot of the research and development that would go into this substance. But at URI and as someone in this space, what does recreational legalization do, if anything, to sort of advance some of the research that may happen at the university and other academic institutions?
Yeah, great question. Unfortunately, it's not going to do much. That we are really tied by federal regulations and we receive federal grant money. If you want to study, high THC cannabis, anything over 0.3%, that's not federally legal under the hemp classification. You still have to go through the FDA. You have to go through the National Institute of Health. You have to go through the National Institute of Drug Abuse. So there's so many loopholes still from the federal side that we have to jump through. Yeah, and even if you jump through those hoops, the problem with a lot of the research is that the National Institute of Drug Abuse controls all of the cannabis that's allowed to be used for research. And until, this year, there was only one place to get that cannabis, and that was from the University of Mississippi. And the argument is that the product that they have is vastly different in potency and just in product variability than what you see on the state market. So even getting the products to test it and to do the research isn't really expanded to what we see through these state markets and through the product that people are actually using.
What is URI? Oh, pardon, please.
Sorry. There certainly is the chance to do more observational study research.
Sure.
So yeah, seeing how health outcomes change, seeing if there's any effects on opioid use. Some places researchers have gotten really creative with doing research. So while they can't provide the cannabis to do the research, they've formed these little mobile units where they'll go to, people's houses after they consume it, and they come out and they, do the testing they need. So there's some innovative things that can happen, but not much is going to change until the federal regulations change.
Yeah. And I think that's one of the strongest arguments, besides the obvious, criminal justice arguments that exist for federal legalization, is that, you're allowing science to operate uninhibited by what are really just cumbersome regulations and a really narrow working environment that is currently what you're basically subjected to. Well, beyond the research aspect of it, there's an industry around cannabis that is enormous and is certainly growing, and there's so many different aspects to it. So I guess specifically, how is the University of Rhode Island engaged in this expanding cannabis industry, and what does this week, if you will, that we see recreational adult use legalization retail come into fruition here in Rhode Island, how does that kind of impact the that aspect of the work that you do at the university?
Yeah, I think that, our main concern here in the College of Pharmacy is really consumer safety. Mm-hmm. And so we've heard from, different people in the industry that there's a lack of qualified employees, that they, even the people running some of the industry, they have questions, and they come, and ask questions. So we saw this need to sort of give a scientific, understanding of the field, to both, help prepare a workforce and to, because that workforce is who's going to ensure that we continue to have consumer safety, that there's, safe extraction, purification, that products are being formulated in a safe, stable way, that testing is happening, that's reliable. So when the package says it has, 22% THC, it has 22% THC. So we've seen really that need to educate, to ensure that, the workers have this understanding so that they can continue to provide these safe products. We've also had a lot of continuing education type programs for clinicians, to help them understand the industry. And, a lot of them don't even understand in the medical side how a patient would even go about getting a medical card. Yep. So there's a lot of education on the clinical side to understanding the industry, understanding that these products are tested and that they're safe, and also the pharmacology of how the cannabis works so they can support their patients. So both from sort of that manufacturing, production, testing side, also to that advising, guiding of clinical side, we think that we're able to sort of give that education needed to ensure that our consumers in the state of Rhode Island, are safe.
Yeah, and that's the big thing that is you hear this from whether it's Senator Josh Miller or Representative Scott Slater, who were really the two people who pushed for the Rhode Island Cannabis Act in their respective chambers, that product safety is something that is enormous, and that we probably won't see this enormous spike in users, that there's a lot of users out there of cannabis that now, if they are engaged in the legal retail system, they're going to have access to tested and, for the most part, very, very most part, verified, quote unquote, safe product. Yet the black market's still going to be there. And I've seen, I mean, it's anecdotal. I mean, how realistic it is looking at Facebook or Twitter for actual information gathering in any context. But I've seen anecdotal posts of people saying, oh, I'm not going to have anything to do with this. This is government, selective government issuing of licenses to open and conduct business at dispensaries. I'm going to stick with my guy. I'm going to stick with the black market, so to speak. What do you think the black market's going to look like in this space? Because when you think about other substances, it's hard to imagine if someone wanted beer that rather than going to a liquor store, they would call somebody who brought beer in like a plastic cup that they manufactured or something. But I mean, how far away are we from seeing the black market in cannabis just disappear?
Yeah, there's a lot to consider there, right?
Yeah.
That hopefully people are going to, turn to the regulated market again, because of the idea that they can trust these products, that they know exactly what's in the products, they know the exact cannabinoid concentrations, that, they can really dial in what they want because they have this data in front of them, instead of turning to the unregulated market that's not tested, that sometimes you hear about, unsafe additives and things being added to the products. So, the hope is that because this is a safer, industry, that people turn away from that black market. I think the thing that can start turning people toward the black market is, if the taxes get too high and it's just, so much more expensive. But on average, most states tax somewhere between 20 and 40%. So we're on that low end. So hopefully that doesn't happen. That we don't, drive people to that black market. I think that the quality that a lot of these cultivators are producing is something that you might not find from, just your buddy who's selling, someone, right? Because we do have, good quality products, good, safe, tested products. And that's the hope, is that people will turn to that instead of to the black market.
All right. My last question here, and this is just kind of putting on your URI hat and just sort of Rhode Islander hat simultaneously. There's so much talk about economic development in different super sectors, like the blue economy, which is extremely valid, the green economy as well. Obviously our meds and eds, even in some of the tech sphere. I know that there's even renewed interest in looking at blockchain, perhaps as a major driver of industry and perhaps economic development of the future here in Rhode Island. What about the cannabis industry? Can Rhode Island be a national or even global leader in the cannabis industry?
Yeah, I think that, we're a small state, so we have that. We can take advantage of that. We can really innovate, try new things. And I think that's an advantage in this industry. The worker-owned co-ops that we're looking to establish, I think, is one of those things that could be, a guide for other states to, keep the money in the community and not flooding out to these multi-state, corporate entities that get a lot of the licenses. So that can help, keep the economy in Rhode Island, keep that money in Rhode Island. It'll be interesting to see what the new Cannabis Control Commission does, what regulations they set, what programs they develop. But I think we also have the chance to create really great community outreach, education, that, a place for people to find credible information, because a lot of people that might be turning to the cannabis industry that haven't before, they're going out and searching the internet and finding, sites like Leafy and all this that maybe they don't trust as much as if we could develop a nice sort of independent education and outreach resource for people. I also think that, having a workforce that's really knowledgeable about the science of the pharmacology to, know how to develop safe products that are reliable, that are stable, that's really going to help innovate. And if we can create innovative products because we have this knowledge base, then, those products are, people across the country, if the walls ever do come down, are going to, want those products. So I think the innovation will definitely help keep Rhode Island in the game.
Really interesting stuff. Hey, thanks so much for your time as always, and look forward to doing it again as we dive deeper into this evolving space.
Yeah, great. Thanks for having me.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.